So the two-cord technique is the one that I kind of grew up with, or started anyway, about 12 years ago when things kind of turned around and I started doing better dentistry. And this is Knit-Pak. This is from Premier. This is their retraction cord, and you can see how it's knitted. And that literally is not just a drawing. That is how it's actually sewn together. And because of the fact that it's hollow like that, it's very easy to pack. The other nice things about it compared to a solid cord is that if you touch it with a burr, it cuts clean. There's nothing worse than touching a solid retraction cord with a burr and it gets tangled up in the burr and it makes that super high-pitched sound that seems like it's going to maybe make you and your patients deaf, and neighborhood dogs start howling. That it scares me. I always jump. I used to jump when that would happen. But this hollow cord does not do that, and it'll carry greater quantities of liquid such as hemodent. So if you like to soak your cords in something like that, in a styptic material to help with bleeding, the hollow cord will definitely hold more of that than a regular solid cord will. You can see it comes in a variety of sizes. I prefer the one on the far left, the 000, and then the number 2 cord, which is over on the right, the second from the back, in that 2-cord technique where the bottom cord goes in first, and then we're going to put a top cord at the end of the preparation. And we leave it in for 8 to 10 minutes, and you can see what happens. Here's the top cord, the number 2 cord coming out, and you can see what kind of sulcus we have here. You can see the bottom cord still in place there at the very base of the sulcus, and there's no bleeding because that cord's still in place. When that cord comes out, there will in fact be bleeding, and that was the problem with the 1-cord technique, was when I just put 1 cord in and pulled it out, there was always bleeding. But look at these margins. A 2 structure beyond the margin, you can't miss that impression. It really doesn't matter. And this is by leaving that cord in, that little green dot there, that's what we get, that purple material right there. That's yellow over here to kind of show that rim of material beyond the margin. And look at that. You really can't miss that. That'd be hard to miss. You could just fling alginate from the other side of the room on a cement spatula and probably hit that sulcus. And those are the kind of impressions that you get.